Mary, we'll be carrying on with the second part of our examination now, that is the physical examination. Okay, please give me some time. You can lie down and relax yourself while I wash my hands.
Sure.
Okay? Okay. The first part would definitely be inspection. Looks like a healthy female. No scars or anything to be noted on the face and all. Okay, so Mary, I will be doing a physical examination that would include me touching your head, your abdomen and your chest. Okay, if you're okay with it.
Yes, I'm fine.
Okay, this lady here is Sister Ulamila. Okay, she is the chaperone. Okay, come and sit. Okay, Mary, can you sit up for me, please? Thank you. Now, Mary, could you turn this way, please? Just a little, please. Okay, thank you very much. Mary, I'll be palpating your head. I want to see if there's any bumps or lumps or the hygiene of the hair and all. Okay, so if there's any area of tenderness, please do let me know. If there's any area that is painful, do let me know. Okay, the head looks good, the hair texture looks good. Okay, your face is symmetrical. Mary, could you look up for me, please? Now I'm going to see if there's any jaundice or pallor there. There's no jaundice, no pallor in both the eyes. Eyes looks very clean and clear. Okay, could you put your head up, please? There's no bleeding in the nose. There's no growth that is seen there. Put your head down, please. Could you open your mouth, Mary? Okay, you take out your tongue. Nice, moist oral mucosa. Could you say ah with your tongue out, please? Okay, there is no infection or anything. The throat looks pretty clear. Okay, the trachea looks midline. Right, there is no supraclavicular lymph nodes that is palpable. Is there any tenderness here, Mary? No. Okay, there is no submandibular or submental nodes, no periauricular nodes here. Right, Mary, could you show me your hands, please? Okay, the fingers looks okay. They're clean. Okay, no hemorrhages, no clubbing that can be seen there. Okay. Now, Mary, I need you to sit straight, please. I will be auscultating your chest. I want to listen to your heart sounds. Now, because this is an educational video and I cannot ask this lady here to take off her clothes. So, in best medical practices, I would have asked this lady to remove her top so that I can have a proper auscultation done. However, I will be telling you the areas where I place my stethoscope and what I will be hearing for. Okay, so starting from the second intercostal space, which I can trace very easily by putting my hand right through the midline here until I come to this ridge here. Okay, so on either side of the ridge, the intercostal spaces that you have, they are the second intercostal right and the second left intercostal spaces there. So as I place my stethoscope on the second right intercostal space, very close to the sternal border, okay, I should be able to appreciate the sounds of the aortic valve. Right, so in this case, the aortic valve looks okay to me. I can hear the S1 and S2 sounds, so there's no problem there, no murmurs. Heartbeat looks regular. On the opposite side, however, if I place it on the left second intercostal space, I'll be listening to the pulmonary valve or the pulmonic valves. Again, I can appreciate both S1 and S2 and no murmurs appreciated there. On the right, third and fourth intercostal space, I'll be listening for the tricuspid valve. And again, I can hear S1, S2 here, no murmurs appreciated. Now, for females, you should note that the mitral valve, you first need to palpate it. Right? You need to put your hand, most of the women, you'll need to get your hand under the breast to auscultate or to palpate for the apex beat. So once you have located the apex beat, which is generally in the fourth, fifth, or sixth intercostal space, in the anterior axillary line, okay, you can auscultate for the apex beat, that is your mitral valve. Okay, now the other thing that I need to auscultate before I complete a chest examination would be to listen to the respiratory sounds. Okay, so I would start my respiratory examination from the apex and then go downwards. Okay, so the idea is to compare one side to the other. You can't just keep going down on either side. So you'll have to do the right side and then the left, or the left and then the right, whichever way you are comfortable with. However, you must auscultate one side and compare it with the rest, and then come down and then to the opposite side. So let's get with the respiratory auscultation done here. Okay, we'll start with the apex here. Take a deep breath in, please. Out, in, 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 out. So that's the anterior part of the chest that we have done. However, we have to do the same thing for the posterior, ensuring that we do not place our stethoscope on the bony prominences of the scapula or the spine. So we have to place it in between the spine and the scapula, and you follow the angle of the scapula, the arch of the scapula on the medial side. Okay, so similarly we can go this side. Okay, in, out, in, out, in, out, in, out, in, out, in, out. Okay. In certain cases, we can go ahead and auscultate the sides, which is in the mid-axillary line, that we can always auscultate to see if there's any disturbances in sound there. However, for this lady, we find no respiratory or cardiac anomalies as per se. Okay. Now, Mary, would you lie down for us, please? Okay. Now we can do a good palpation of the abdomen as well here, since he's having a radiation of pain from the epigastrium to the stomach area. Okay. So Mary, would you lift this up, please? Thank you. May I? Thank you. Okay. So abdomen on observation, normal size and shape with stretch marks that you can see there. No surgical marks that is being appreciated there. Okay, Mary, I will start with palpating your abdomen. Is there any area of tenderness there? Before I start, is there any area of tenderness on your abdomen?
No.
No. Okay, or none that you have noted?
No.
Okay. So, I'd like to auscultate the abdomen before I try to press on it. The reason being that the bowel sounds gets distorted when you press them around. So I'd prefer auscultating the abdomen before I start palpating or percussing. Okay, I can hear the bowel sounds pretty clearly there. So the bowel sounds are present. There is no carotid roots that I can hear there. There is no stenotic artery that would give me any abnormal sounds there. The abdomen is soft. And now I'll go ahead with my palpation. Okay. Is there any area of tenderness? Please do let me know. I cannot feel for any masses there. Okay, the patient doesn't look in discomfort while I'm palpating the abdomen. Okay, okay, thank you so much. Now, Mary, there doesn't seem to be any problem that is of note on your abdomen or chest. Okay, however, on your signs and symptoms, from our nursing point of view, I would say you probably have a problem with your digestion, with your acid secretion, And for that, we will provide you with a proper referencing, and we'll be giving you a referral letter to see a clinician. Okay? Thank you so much, Mary, for your time. Is there any questions you would like to ask us?
How long will it take to see the doctor?
Well, you can see him tomorrow.
Is there anything I can get for time being for my pain?
We could give you over-the-counter medications for suspected gastritis probably, and see if it helps you in any way. However, even if it does help you, you will still need to see a doctor.
Okay. I'm fine with it.
Okay. Any other things you would like to know, Mary?
No, thank you.
Okay. Thank you so much for your time, Mary.